Hi, my name is Casey, and I'm a health and fitness expert here in South Florida. I recently underwent prophylactic mastectomy with immediate reconstruction and noticed a void in exercises to help women after surgery. So I wanted to go ahead and make a video to help anyone else out there who might be a little confused on how to start integrating exercise after surgery. I just want to start by saying congratulations to all of you women out there courageous enough to go ahead with this surgery. We're a new generation of women who are changing our fate, so we don't have to be diagnosed or live with breast cancer. So I just want to say congratulations on your decision. So there are a few different options when you choose the prophylactic mastectomy. I personally went to immediate reconstruction with nipple sparing. So I ended up having a few complications. I know some women, they have tram flaps, which is where they actually move parts of either your belly or your buttocks and take the blood vessels, the fat, the muscle tissue, and move it to reconstruct a breast. Some women opt for spacers first, and that way they can extend the tissue and then switch to a permanent implant 6 weeks later, or however long it takes to extend the tissue. So everyone's journey through this is a little different. So, and because there's nothing out there, I'm going off my certification for training women with breast cancer. So with that and my personal journey through all this, I'm going to share some exercises with you on how to start moving again and get out of the funk of being in recovery. So I hope you learn a few things, and definitely make sure to talk to your doctor first before starting any of this. If you're allowed to bend over, or also women with tram flaps, they risk having a hernia. So I didn't have that surgery, so just make sure you check with your doctor. And if you have any pain, swelling, shortness of breath, just stop and relax and discontinue the exercise, and we'll pick it up another day. So the surgery, it affects not only your pectorals, but also your serratus anterior, your lats, your shoulders, and your internal rotators. So there's a few different range of motion exercises specifically that you want to focus on within the first couple weeks. But first we start with basic things of just moving the wrists. So you want to flex and extend the wrist on each side. This is going to be the easiest thing to do. You can start this on day one. So just a few times on each arm. After that, I want you to go ahead and make a fist and just squeeze. So you're just waking the muscles up and squeezing, getting that blood flow. So each side, you just need to do it a couple times, and this is within the first couple days. So this is where you're starting. Level 1, okay? Okay, so your range of motion is definitely going to be limited. So of course, that's what we're working on. So after your wrist exercises, when you're ready, we're going to start working up to the elbows. So we're going to flex and extend the elbows. Again, these are exercises that you can do in your bed while you're recovering. So the first week, this should be fine. When you have drains or wounds, that's when you want to think about the exercises that you're doing first. So as we start to get into the shoulder exercises. So I'm going to go ahead and show you. Now again, the main thing here is you don't want to get infection. So if you have a wound, the last thing you want to do is rip it open. So assuming that you're okay to go, we're just going to raise our shoulders up and down, raise our arms. So again, we're going to abduct the arms and bring them back. Again, just 5 times. That's it. That's all you need to do within the first couple weeks. That's it. Okay. After that, we're going to bend the elbows 90 degrees, and we're going to rotate out. So a few times here. And we're good. So after about 2 weeks, you're going to get your drains out. So this means that you're going to have a little bit more range of motion. So we're going to go ahead and do some more, we want to test it first. So, and this is also important for your daily activities. This is what you want to work towards. So testing shoulder external rotation, it's almost like washing your hair. So try it on one arm first, and then we're gonna go ahead and do the other arm. Now the stretches, when you wanna hold a stretch, you wanna hold it for about 10 seconds. And we're gonna switch off. So again, external rotation, just as if you were washing your hair. Hold it, and switch, repeat the other side. Okay, so internal rotation, that's where if you need to unhook your bra. So again, I'm gonna turn around for this one, just reach behind you and hold it. So ideally, you want to be around somebody when you're doing these, especially if you're on medicines that might make you dizzy or weak. So if you can't be around a health professional like a nurse or a physical therapist, have somebody next to you so in case anything happens. The last one we're going to do is shoulder flexion. So if you have to reach for something high up, that one was a big trouble for me. So just reach it up, hold, and you might not be to this range right now. You might be just here, but that's the whole thing, is you go to where you can, and then when you relax, the next time you go to stretch, that next rep, you should be able to go a little bit higher. So we're slowly increasing the range of motion. Also, when you're doing these moves, you want to focus on breathing. Deep breaths in the nose, exhale out the mouth. The breathing is going to help with lymphatic circulation as well. So that's important for your recovery, lymphatic fluid. So just make sure you focus on deep breaths, bringing in, and also you should be able to really expand the chest by now if you've been doing those breathing exercises with the spirometer that they give you in the hospital. So deep breaths, and this is also important for it decreases depression. It's going to help with anxiety or any other things that you might be having a problem with while you're going through the recovery, because it is hard to be put in this situation and have autonomy taken away from you with certain things. So and bringing that up, you try not to rush into what you were used to. You want to ease into things. I personally didn't drive for about 2 to 3 weeks, and when I did, I put the seatbelt behind the seat so that it wasn't pushing on my chest. Also walking my dog, that there's a liability or risk issue with that, where if they pull on you. So just keep in mind, and definitely make sure that you are not lifting anything heavy. That is rule number 1, because even opening a fridge door or opening a can, you're gonna feel those things in the first couple of weeks. Your body, those nerves are getting used to what you put through it. Some of them may have been cut, so everything's regenerating. It's gonna feel different, it's gonna feel weird, but in a few weeks you're gonna feel great. So continuing with level 1 exercises. So no matter what surgery you had, tram flap, or you went to spacers or immediate reconstruction, these are all level 1. So we had the wrist, we had the elbows, and then we went to our shoulder exercises. So now focusing, we're gonna go to neck, okay? So especially when you're laying in bed for a while, you're gonna need to stretch that neck. So go ahead, drop your chin to your chest, and we hold it 10 seconds. When you're ready, rotate the ear to one shoulder, hold it for 10 seconds. I'm actually even pulling on that arm just to deepen the stretch on this left side. And then when you're ready to roll it to the other side, you want to roll forward. You never want to roll your neck back, then you're crushing your cervical spine. So again, hold it. So level 1 exercises for anybody in recovery from prophylactic mastectomy. Again, so now we're moving forward. We're going to go shoulders, arm across the chest, pull it in, hold 10 seconds. When you're ready, switch off. So we're starting with just 5 reps of everything. And as you get more mobility and range of motion, you can move into 10 reps of everything. But I personally would recommend also starting a walking program. Obviously you don't want to run, but walking is also important for increasing the motility in your GI tract, which could be slow because of prescription drugs you might be taking. So if you can't, or if you're feeling weak or fatigued for any reason, if you can't consistently do 20 minutes or 30 minutes 3 to 5 times a week, try to break it up in 10-minute bouts. So 10 minutes in the morning, do your stretches, and then 10 minutes at night, and then you can repeat your stretches. So I would recommend, if you can, doing the walking first, because walking is actually going to also increase your blood temperature. That way you're not stretching a cold muscle and possibly tearing things or making anything worse. So moving on, we're going to do just like the external rotation after you tested it. This is the tricep stretch. So I'm using this other hand to slowly stretch behind. Now, again, you're not going to be here right away. So it's something to work towards. And each side is different. That's why we went through the exercises to figure out what your range of motion is. So we're going to hold again, switch off. Moving on though, chest. So interlock your hands behind your back. You want to pull your shoulders down and look up. You want your chin up. So I'm pulling the shoulders away. Again, if at any point you feel any pain, discomfort, dizziness, make sure to discontinue the exercises. Now we're going to go ahead and stretch that back. Interlock your fingers, round the back, tuck the chin, and push those shoulder blades away from each other. So I'm separating my shoulder blades. They're really tight from sleeping and from laying on my back in recovery. So good. Real quick note, if it's okay with your doctor and you don't have any surgical glue on still or your wounds are closed, you can do these exercises in the pool and it'll actually make it a lot easier because you're taking out gravity. So the water will assist you in these movements and help with any pain that you might be having. So I just wanted to throw that in there. Also, if you're unable to walk for whatever reason, you can use the recumbent bike or any bike. I recommend also walking inside on a treadmill versus going out there in the heat, or, you know, because in case anything happens or you don't have somebody with you. So these are just also precautions to keep in mind because you are on medicine. Okay, so now we're moving into level 2 exercises. So again, this is for anybody, whether you had spacers or the tram flap. So level 2 exercises, we're going to do arm circles. So you start small, we'll go 10 forward, and then we'll go 10 back. Okay, so just one set of these. After you give your body a little rest for a second, you can try to do them bigger. Again, make sure that you don't want to rip any wounds open. So we're going to go 10 nice and slow and controlled. There's no need to rush. Focus on the breathing. And after 10, go ahead and reverse. Level 2 exercises. So next, we're going to go ahead and lay on the floor. I have a towel with me. So we're not strengthening anything. The last thing we need to do is make anything tighter. So go ahead, lay on the floor. Ease into it if your chest still hurts. Okay, so knees bent. You want to keep your lower back pressed into the ground. I'm going to put my hands about shoulder width apart. So I'm just going to do almost like a chest press. I'm just going up and down. So here, again, we're just going to do 10 reps, just like this. After 10 reps here, we're going to do kind of a tricep and chest stretch. So you let them drop. Again, this might be where you are right now, and that's fine. Come right back to where the hands line in with the shoulders, and then fall back. Nice and slow and controlled. And exhale when you come back. So you're inhaling on the way back, and then exhaling, bringing it up. So level 2 exercises, continuing. Okay, so now we're going to do a total body stretch. So go ahead and you just want to stretch your legs out. And be careful if you have the tram flap of coming down, not using your abs. Just let your arms hang over. You just want to hold yourself like this. You shouldn't feel too much tension doing this. So just relax, and you can practice your breathing exercises, meditate down here. Again, that's going to help with any kind of depression or anxiety that you might be having while you're going through recovery. All right. So be careful coming up. So we're going to go ahead and stand up now. So coming all the way up, nice and slow. Again, sometimes you can get dizzy if you stand up too quick. So I'm going to come over here to the wall. And I want you to practice wall climbs is what we're going to call it. So you face the wall, because one of the hardest ones for me especially when I was going through recovery, and that I noticed with a lot of women, is the shoulder flexion. So you're going to slowly climb the wall. So you can do it while you're facing the wall, And if you need to stop and let it relax for a second, you can do that. And hold. Good, and then slowly come on down. So you can practice that a few times on each arm. And then to actually get more of a chest stretch in at the same time, we can face away from the wall and climb up and down. A few times each arm. Good. All right, so next, side bends. Okay, so again, I'm just gonna reach my arm up and slowly come on over. Okay, tram flat people, be very careful. Talk to your doctor before you do this move because it depends on where you are with your recovery. So reach over. See, this hand here is reaching for my knee, and then I'm coming up. Reach for the knee and come up. So a few times on that side. Come on over, other side. Reach and come up. Very slow into this one. Nice and slow. And back up. And that's level 2. All right, so these exercises are specifically for those women who have had tram flap procedures. So again, under doctor approval, you can go ahead and start with these level 1 tram flap exercises. So go ahead, place your hands on your lower back, right above your butt, and you're just gonna bring those shoulders back and start to look up. Deep inhale, exhale, back to center. So this next one, you should be able to go a little bit further. Inhale. Your eye gaze is going to start to slowly come back. Now, we're not trying to get a back bend. We're just trying to ease you into the next exercise. So push that chest up, arch that back slightly, bring the shoulders back, and exhale back to center. So again, nice and slow, hold it for 10 seconds. Breathe. And good. So hopefully each time you're able to go a little bit deeper. Now coming down to the floor, we're going to go ahead and ease you into another exercise. Now I like to start with the arm first to warm you up because this involves the core. So we're going to do the right arm. We're going to extend it, bringing it in and out 10 times. When you're done with that set of 10, you're going to work the reciprocal leg. So you're going to extend the left leg, bringing it in and out 10 times. Again, hopefully this is not giving you any discomfort holding yourself in this position. If it is, please discontinue. All right, so now after you've done 10 on the right and then 10 on the reciprocal left, we're going to go ahead and integrate them. So extend the right arm and the left leg at the same time. See, this takes a lot more core control. So 10 times, nice and slow. Inhale, exhale. And then go ahead and repeat on the other side. So now, after that, let's come on down. Hopefully you're comfortable to be on your chest. If not, don't do it. So forehead starts on the floor, and you're going to gently lift up. People in yoga might recognize this as a cobra. So you want to exhale as you come up. Inhale on the way down. Deep inhale. And breathe. So you're going to feel this in your lower back and in your abs. So after a few of these, if you're comfortable enough, you're going to go into upward dog. So again, now from this position, push all the way up. So now this is a deep ab stretch, so be careful. Start maybe just to here, and then on your next rep, you can push up a little bit higher. Always make sure to breathe. So inhale, exhale, push up, and hold. All right, so after 10 of those, go ahead and swing around. All right, so I'm going to integrate some exercises for Pilates. So assuming that you're okay with those exercises I just showed you, anybody can do these Pilates exercises, and this is actually going to work your legs and your core. So hands by your side, lower back is tucked in. You're going to point the foot and slowly draw circles. So you don't want your hips to sway off the ground. You want to nice and controlled. Because right now you won't be able to do a traditional crunch, but these will help in getting those ab muscles working again. So we'll go 10 in one direction, slowly drawing circles on the ceiling. 10 in the other. If those exercises are okay, then let's go a little bit bigger. 10 in one direction, 10 in the other. So inhale, exhale. So after 10 and you switch, then go ahead and alternate your legs. All right, so we went over a few different exercises, and again, make sure that everything's okay with the doctor before starting. But I just want to make sure also that number one, you focus on nutrition. It's really important for recovery, especially if you're not able to do exercises and burn calories, or you're losing muscle from being in recovery. It's important that we decrease the inflammation in our body. So eat as organic as you can, lots of fruits and vegetables. Try to stay away from anything heavy and salt, sugar, dairy, alcohol. Things like these might impair your recovery and cause more inflammation. So if you need help with that, I've incorporated my nutrition plan on Lisa's website, My Destiny. So other than that, you can email me any questions at caseysgymclass@gmail.com. And I hope you have a happy and healthy, speedy recovery. Thank you.